So it's my great pleasure to introduce my good friend and colleague, Dr. Gretchen Boules. Dr. Boules has the distinction of being the 5th licensed prescribing psychologist in Illinois. And what a journey that was.
Yes, I will say so, yes. I can't believe it's been 10 years.
Yeah.
Yeah.
And we started talking about it right after our law was passed.
Right.
We had lunch and
we had lunch.
yeah.
And 2 weeks later, I was in school.
Yeah.
With my family's consent.
They didn't know, nobody knew how difficult that was. I need to give you a mic.
Oh, thank you. Yeah.
So you are the secretary of the board of the Illinois Association of Prescribing Psychologists, and you're the program manager for the Prescribing Psychology Fellowship at Ascension Health Systems, formerly AMITA. As the founder, president, and CEO of Boules Clinical Psychology Group, Dr. Boules runs a group private practice employing about 7 therapists, including 2 other Illinois licensed prescribing psychologists, Dr. Brandy Bone, who's not here, who is the 2nd prescribing psychologist in Illinois, and Dr. Nancy Healy-Haney, number 8, and then Dr. Ken Fogel, who is preparing to become a prescriber. Right, at the full-time faculty of the Chicago School, also works with Dr. Boules. And you are a highly skilled clinician, also a board certified telemental health provider and a registered yoga teacher, as we talked about the Renaissance woman. And you're a piano artist who you still compete in piano competitions.
I do. I'm amateur, but I still compete. It keeps my brain going. So I do have a competition in June, playing Chopin's Ballade No. 2.
Fantastic.
So.
Fantastic.
Thank you.
So what Dr. Boules is going to describe to us tonight is the fellowship training program that she has developed at Ascension, and that you manage, and that Ascension, and we're going to hear more about that from the CEO of Ascension Behavioral Health, Clay Chia. It's because Clay was the one who envisioned how the Ascension Health System could be the premier training site for prescribing psychologists. So, and you're going to give us the insight, Dr. Boules is going to give us the inside information on the high value of the training that prescribing fellows undertake at Ascension. So, and here it is, Dr. Gretchen Boules. Thank you.
Thank you very much, Beth. And I want to thank Beth. So I have not been to one of Beth's events since COVID.
Yeah.
But you're right. I mean, I do recall, and Ted and I were talking when we came here. There was like standing room only. I mean, it would be 150 to 200 people in this space. But so happy to be here today, and I've got a few thank yous that I'd like to make before I speak. And first and foremost, I'd like to thank you, Beth, for your incredible hospitality, your wisdom, your warmth, and your inspiration to move me in this direction. Some words that describe Beth: I would say she's a true visionary, a fellow friend of ours, and a psychiatrist, if you recall, called Beth a Rainmaker. And I would say that truly exemplifies who Beth is. And I would like to call her the matriarch of our RXP family.
Thank you.
And I think that really depicts what Beth has done and where she continues to take us. I'd also like to thank Clay, and I know Clay will be speaking shortly, but for taking on what I call the great experiment. And Clay and Dr. Rocco DeMonico agreed to take this on, and it was a great experiment, and I believe it has really come to incredible fruition into a very cutting-edge program. And that is exemplified by the fact that I'm getting calls from people all over the country. So this has become a very well-known program. So thank you, Clay. Thank you, Rocco. I'd also like to thank my cohort of fellows, some of whom are here tonight: Claudia, Nancy, I don't know who else is here tonight, Lisa Bush. We did it together, and we really forged an incredible path. And I think we did that for the future RXPs. So thank you. I mean, we all did it together. We were a team. For my current RXP fellows, Glenn, and I think Dr. Cindy Steer is on the call, and I've got a few more. Thank you. Your pioneering spirit is incredible, and you're just going with the flow, and that's what we need. Okay, and my family, of course, my husband here, for your unwavering support going through all this, and fortunately, I'm done with all the school. A little bit of my history coming into becoming the program manager here. I've been in private practice for 30 years, and I was also the training director at an acute care hospital in the 90s, which is where I met my husband. And we had no training there. There was residency training, but there was no clinical psychology training. So I thought, let's start the ball rolling. So I started with a diagnostic practicum, moved into therapy, and then ended up with an APIC internship before I left the hospital. So I started my rotations in psych at Linden Oaks, and then I moved on to what was AMITA at that point. And Dr. DeMonico had started the ball rolling. I think myself and there were a couple other trainees that were helping him really develop this program. And so, again, we had basic rules from IDFPR as to what we needed. And it was up to us to kind of design, be the architects of, what was important to become an RXP. Rocco was really great at numbers and, beautiful charts and everything. And I was great at the relationships. And so we really worked together to create a masterpiece, is what I would call it. So again, we have 9 medical specialties that we have to rotate through within 14 to 28 months. 1,620 hours. And I will tell you, and those of us who've gone through it already, we're thinking, oh my God. But I do remember, we thought, you've got to be kidding. It's the most robust state in terms of training. We have the most requirements for any psychologist to become a prescriber. But we did it, and we continue to do it. And I think there are a lot of medical people in the medical community that didn't think that we would. So here we are today. So we had to come up with an idea of, okay, what's most important? So we thought family medicine, internal medicine, emergency medicine, those all needed to be 2-month rotations. Psych, we did the first 3 months. But then we thought, okay, how do we design this? We don't start with psych, go into these medical rotations, and just walk out the door. So we designed what we call the initial psych rotation for 3 months, and then we do all of our medical rotations, and there's no particular order. And then finally, we designed an advanced psych rotation. And so the idea behind that was it's kind of like finishing school. That you've completed, you've started psych, you've seen all kinds of things in the medical field, and then by the time you get to the advanced psych rotation, and most students choose their elective advanced psych, so you've got 2 months, you can walk out the door, get your licensing application in, and start prescribing. And we also developed the idea of having a psychiatric preceptor throughout your entire rotations at Ascension. That way you keep some continuity. They meet with you once a week for an hour. They know you. You can talk about medical cases with them. It's just become very beneficial. So we have core competencies, and the fellows are evaluated on a monthly basis on these core competencies: medical histories, mental status exams, review of systems, physical exams, labs, orders, EKGs, patient education, differential diagnosis, and integrated treatment planning. And then we have something very unique that we created. We call them medical psychopharmacology summaries, or MPSs for short. Part of what the Illinois license requires is that we do some kind of research. So we thought this was a really nice objective way to do some research throughout your rotations, get feedback from your medical preceptors. The psych piece is very predetermined. We have 10 papers that we write. And then for every other rotation, you write 1 paper. And so it would be something about perhaps a psych medication and how you might incorporate that into someone who's diabetic, or someone who has a thyroid disorder, or blood pressure issues, or whatnot, cardiac illness. So it's really what I would call a full immersion into the medical community. And I know Dr. Sample right here is in the midst of that, very full immersion. You really, really have to learn how to jump in. It's so different from being a clinical psychologist. We're used to sitting in a room and processing things and having your supervisor to meet with for an hour. No, you jump in, You're looking at labs, you're talking to patients, you're walking up and down hospital halls. You really have to be stealth-like, and embrace that process. And so you need to be ready for that. Okay, some other highlights here. We had to become IDFPR approved, and that was a big, wonderful process. I remember sitting down with Dr. DeMonico and Ken Kessler, who's not here tonight, but who is also a prescriber, and we wrote the application to IDFPR. And once we did get approved, now anyone who comes through Ascension essentially is approved because that they know that our training is excellent. Another little, I wouldn't call it a roadblock, but it was an interesting, so when we started, it was a META. META split up. We lost 4 of our hospitals, but we lost quite a few of our preceptors. So the good news, bad news is, the good news is, most of those preceptors are still in contact with those of us who have gone through the training. They refer to us. There were a couple of them that wanted to hire us. And now we are meeting new preceptors, new doctors, and educating the community essentially about what we do. And so that's the good news. So currently, I have 6 fellows as of April, and we are really at full capacity. I am getting calls probably monthly for people to come in, and I have to kind of space people out, and I know that can be frustrating for some, but in order to have quality education and quality program, I really do have to space people out. We are constantly evaluating the program and building the system. Like I said, there are doctors who have worked with us who continue to refer to us and who have wanted to hire us. I know Dr. Lisa Bush, there was a hardcore press. One of the family practice docs really wanted to hire her. And again, we're continuing to expand RXP and hoping to hire more in Ascension. As a side note, I have taken the training full circle. I started at Ascension, and I am now the only prescribing psychologist the last 2 years who is actually seeing patients through the community mental health center there. Another interesting aside, the psychiatrists in that group have an MD meeting that they've called it. They meet monthly, and they've changed the name to a prescribing meeting to include me, which has been very nice. So again, Ascension is becoming very well known for its excellence, and I know that because we are getting calls all the time. As a matter of fact, I think one person on the call here, Dr. William Prince, he has reached out to me, and we are in communication about what that will look like going forward. So thank you so much. If you have questions, feel free to reach out to me. It's an exciting time, and it's just gonna get better and better. So thank you.
Wonderful. Thank you. Thank you so much.